In our first section of the Un-Botched, we're going to be discussing capsule contracture. Capsule contracture is an abnormal healing process that happens around a breast implant. This is the most common complication of breast implants, which happens in approximately 15 to 20% of the cases. This is a rather significant number, but there are different degrees of capsule contractures. Dr. Baker had described 4 different degrees. Grade number 1 is a normal capsule. It's a capsule that is pliable, soft, and a normal process of a fibroconnective tissue that forms around the implant to isolate something that is non-biologic. This happens around any implant, call it a pacemaker or even a knee arthrodesis or replacement. These capsules can behave in an abnormal way. So grade number 2 is when the capsule starts hardening. Because the breast implants are so soft, any hardening or abnormal scarring, internal scarring that happens, you're gonna feel it like a lump or an area of induration of the breast. This is called a capsule contracture, grade number 2. Grade number 3 is when the hardening is so significant that creates an asymmetry. So one breast looking either higher or lower or displaced to the side, that creates a significant asymmetry compared to the contralateral breast. And the grade number 4 is the most severe of all, where it causes pain. Usually for grade number 3 or grade number 4, you need some sort of treatment. The first line of treatment is the medical treatment, and we do this with a medication called Singulair. Singulair, as you might know, is a medication used for allergies or asthma. It's a medication that is used to decrease inflammation, usually in your bronchi or your lungs, but it's also been shown to be effective to decrease the hardening of the capsule in the cases of capsule contracture. So about 50% of the patients can benefit of using Singulair to treat the hardening of the capsule. Now, in the cases that this is not effective, then you will require what we call a capsulectomy and implant exchange. The capsulectomy is the removal of the complete capsule along with the implant. In this case, what we do is we remove the capsule completely and the implant, because since we are not sure what is the cause of the capsule contracture, we know that there is an abnormal inflammation that might be triggered by biofilm or some sort of contamination of the implant. In this case, it is required to remove completely the implant and the capsule around it. So, the reasons why capsule contracture happen, although they're not very clear, we know they are related to some sort of abnormal inflammation. A poor technique or bleeding after surgery could make you more prone to develop capsule contracture, as well as a technique that is not completely clean, where you can have contamination or even infection, which will make you more prone to develop capsule contracture. But even in cases where you're super careful, there is no bleeding or minimal bleeding, and there is no real source of infection, you can still develop capsule contracture, which happens in between 15 and 20% of the patients to be symptomatic. So, the best thing to do is to follow up with your plastic surgeon, consult with them, and talk about the alternatives that you have to address this problem. Hopefully this video has been instructional and you can have some idea of what to expect if something like this happened to you after your breast augmentation, breast reconstruction, breast lift, or any sort of surgery that will require a breast implant.